my name is Dr. Anna Swan, and I'm a psychologist at UCSF. Thank you for joining me to learn about anxiety coping strategies for children and teens. Today, I'll be describing strategies often used in cognitive behavioral therapy, which is an empirically supported treatment for child and adolescent anxiety. So the first step in managing anxiety is to know that you're feeling nervous. And sometimes this feels obvious, and other times it can take some practice to identify clues. So some common body sensations that go along with anxiety include feeling nauseous and having an upset stomach, trouble sleeping, muscle tension, headaches, feeling more irritated or grumpy because you're worried, racing heart, sweaty palms, trouble breathing. And all of this happens because your body is preparing you to confront or run away from a dangerous situation. And there are times when this is really useful, but when your main goal is to stay safe and healthy at home, some of these body feelings can be distressing and a bit of a false alarm. So once you know that you're feeling nervous, the second step is to identify, label, and even write down your worry thoughts. So anxiety loves to do two things. The first is to make us focus on the worst case scenario, even when there are more likely outcomes. And the second is to convince us that we're not going to be able to handle what might happen. Firstly, it's okay to feel worried, and most people are feeling more anxious right now. If you notice that you're getting stuck in those worries and it's making you feel more anxious or distressed, there are strategies that can help. So that brings us to the third step. Once you know how you're feeling and what you're thinking, the third step is to take action, to do something to turn down the volume on your anxiety. A great action to start with is developing habits and routine. So right now, so much of our day-to-day is different, and most people feel more nervous when things are uncertain and we don't know what to expect. One way to help with this is to develop daily habits to increase certainty about what you can control. When you develop a new routine, you know what to expect, and as structure kind of increases that predictability about your day-to-day, anxiety can lower. A second action to help is using relaxation strategies like deep diaphragmatic or belly breathing to calm the body down when you're feeling nervous. So when I teach this to little kids, I'll often call it pizza breathing. So you breathe in through your nose to smell that good pizza smell, and you breathe out through your mouth to cool it down. And as you breathe in, your belly expands, gets bigger like a balloon, and as you breathe out, your belly goes down. And there are also some really great apps that include relaxation scripts like Virtual Hope Box and MindShift. A third action is to identify helpful thinking. So if you notice that you're getting stuck in those worry thoughts about things that are happening in the world, it can be helpful to ask yourself questions like, is this in my control? Whose job or responsibility is this? Is it mine? Is it my parents, teachers, doctors, state leaders? What is my role? And then as much as you can, try to focus on doing your job to the best of your ability and let others do theirs. It's also really common to get stuck in worry thoughts about bad things happening in the future and your ability to handle it. So to get unstuck from this worry spiral, I really like to think about the Mr. Rogers quote, which talks about how when he was little and used to see scary things on the news, his mom would always say, always look for the helpers. You will always find people who are helping. And then Mr. Rogers goes on to say, and I did. And I came to see that the world is full of doctors and nurses, police and firemen, volunteers, neighbors and friends who are ready to jump in when things go wrong. So if you notice that you're getting stuck in those worries about the world, look to the helpers, and there are a lot of them, and know that you're not in this alone. A last action to help is to engage in activities that are important to you, that make you feel good about yourself, even if you feel nervous doing them. So there might be certain situations totally unrelated to the current crisis that make you feel nervous, whether it's around school or friends or family. And usually when we feel anxious, we try to avoid or get out of those situations that make us uncomfortable. And the more we avoid, the more we stay nervous. So I encourage you to take small steps to participate in activities that you care about, even if you feel nervous doing them. And with practice, you might get more comfortable and feel less nervous overall. All right, so then the last step is to try some of these strategies out, see what works for you, practice on a daily basis, and don't forget to reward yourself or have your parents reward you for using some of these strategies to manage anxiety in a really difficult time. And if you notice that you're feeling overwhelmed and it's hard for you to do the things that you need to do or want to do because of anxiety, please do talk to your caregivers or another trusted adult about meeting with a licensed mental health professional. Thank you so much for listening. You've got this.